welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, we are talking about colorectal cancer and colorectal cancer prevention. On my episode today, we've got a full house in here today. We've got Elizabeth Vickery. She is the outreach manager for Kirkland Cancer Center. We've got Abby Mays and Rene Hampton. Welcome, ladies. Thank you guys for coming on.
Thank you.
Thanks for having us.
So, Elizabeth, I know you're a frequent guest of ours. How have you been? How's it been going since we last talked?
It's been busy, but it's been really good. We've got a lot going on, and everything's going good at the Cancer Center.
Great. So, Rene, let me talk to you. So, tell us kind of what your position here is and how long you've been here.
Sure thing. I'm our GI navigator at Kirkland Cancer Center, and I've been there for 8 years.
Right.
And we've seen a lot of changes in colorectal cancer occurrence and screening the last few years. So I see patients that have new diagnosis of any type of GI cancer, but of course March is the time that we focus on colon cancer specifically.
Right, exactly. And Abby, tell us a little bit about yourself.
So I am the clinical dietitian at the Kirkland Cancer Center. I have been there for about 1.5 years, and my role there is just to assist in the doctors, the nurse practitioners, to help with any nutrition-related side effect that may be going on with different cancer treatments, and really help our patients optimize their nutrition status during treatment and even post-treatment.
Right, sure, yeah. Now, Rene, you've been here before.
I have.
Abby, have you been here before?
Yes, it's been a while.
Has it been with me or was it with Will?
It was with
Okay,
Will.
I was like, let me make sure because some people have one of those faces and I'm like,
Yeah.
a lot's been happening lately.
That's right.
So that's great. So yeah, for March, it's Colorectal Cancer Awareness Month. We're going to be doing a screening with Kirkland Cancer Center. But I guess to start out, I wanted to talk to you, Abby, as the clinical dietitian. How does prevention play a role and what is your role within that for colorectal cancer?
Nutrition plays a huge role in the prevention of colorectal cancer. We know that our weight, our physical activity, and our nutrition habits all affect our risks for different cancers, especially colorectal cancer. So from a nutrition aspect talking, it would be really just making sure we're eating more of our fresh fruits and vegetables when those are in season, when those are affordable. And I know that's a big thing right now as groceries are so expensive, but really making sure that you hit the resources that you need to be able to afford those fresh groceries. Again, fruits and vegetables, eating a multitude of colors, not just limiting yourself to one specific color or one specific fruit and or vegetable, but also limiting our red meat. That is a big thing. So red meat, and even our processed meat, so your bolognas, your bacons, your sausage, pork. And it's not to say that we don't need to eat those. Those definitely have their health benefits, but just decreasing our portion intake with those.
I guess, yeah, it would be using that as like a treat or something. You can maybe put that on your calendar to say, I'm going to try to hold off and then have a day where I'm like, okay, I'm going to let myself have this.
Right.
So when would someone come see you? Would they need to be referred or how would you be part of the process of them getting the treatment and things like that?
So at the Cancer Center, we do a nutrition intake on every patient's first treatment day. At that point, I assess their nutrition status and if they need to be seen based off of weight, decreased appetite, or any type of financial food insecurity. But if they do not meet those qualifications, then I go based off of working with our navigation team, our social work team, as well as the doctors and the nurse practitioners, and even our nurses on the medical oncology floor, the infusion floor, and our radiation oncology team.
Right. And before I move on, I want to ask one more question about kind of what you were saying about the foods that you eat and purchasing and things, especially with the prices being so high. Do you give people specific places to go to, like is Aldi an option, or, to kind of help? Because that's how I am too. Like I like to budget. So I'm like, if I can get a deal on something, that's what I'm doing. So, or like, what's the best way to get what you need and not break the bank, I guess?
Definitely sourcing out different places that you shop, looking at the sales, looking online at, different opportunities that they're running for different foods and food options. I would say I'm not going to give someone a specific place to shop, but then that's where our social work team does come into play as well, is seeking out RIFA if that's needed, seeking out food banks and knowing what's appropriate and available in the counties in which our patients live to assist in that matter.
Right,
if
and
needed.
here in the West Tennessee area. And so that's something that somebody at the Kirkland Cancer Center can help those.
Absolutely.
They wouldn't have to go somewhere else to get that information. Okay, great. So now, Rene, I hear Nurse Navigator because I work here, but I'm not clinical at all. What is a Nurse Navigator? Like, what is that specific job?
So, good question. A nurse navigator is typically a registered nurse that has some experience in the field that they're serving. And we kind of overuse the word navigate, but that's literally what we do, is we meet that patient on the front end, typically the day of their consult, maybe even before they come to the Kirkland Cancer Center, and we talk with them about their diagnosis. We give them so much written education information, information about the resources that we have available in our community and at the center, and then we also guide them, walk them through, encourage them through their journey with cancer. And for some, that may be, it may have no timeline on it. They may be treated for the remainder of their life. For some, it may be a short time period of 3 months or 6 months. But in my role specifically, so many of our colon cancer patients fall under the surgical piece of oncology. And we do many colon cancer surgeries here in Jackson for colon cancer. And many times surgery is all that is needed to treat colon cancer. But when it's not, and it goes beyond that, we want to walk with that patient through that journey, support them with any side effects that they're having, any questions that they have. And then also another super important part of it is to educate them on not having a recurrence within what they can control, as well as their family members, because most patients will bring a family member or members with them. So it's a great opportunity for all of our navigators to talk with patients and their families about things that they can do to prevent a recurrence and also to prevent other types of cancer. So we spend, as navigators, a lot of time talking about prevention and screening.
And you're doing this, at the beginning of, and like during, I guess, and after, kind of, is it like a well-rounded, all around?
That's exactly right. That's until a patient reaches what we call survivorship, which is when they're just in surveillance. But even then, I've certainly had some patients that I want to continue to follow for a year or so, make sure their scans look good, make sure that next colonoscopy looks good, and then they're good to go.
Great, yeah. So in terms of once they get to Kirkland Cancer Center, is this something where maybe they're doing it would be like a regular colonoscopy? Right. And if, something is found, what happens after that? So if they find something, do they do a biopsy and then send it to you guys? Or what is...
Such a great question, and it has many answers.
Right, yeah. So I guess it's different for everybody.
That's right. So let me try to simplify. Typically, and hopefully, a patient will not come to us as a result of presenting to the ER. But that does happen sometimes. Because with colon issues, a person can develop an obstruction, can develop, bleeding, pain, things that are obviously abnormal that prompts them to making a trip to the emergency department. And then unfortunately, we start that process. Typically, a colonoscopy is going to be done on the very front end. Okay. And then if a cancer diagnosis is made, for colon cancer, that can go many different ways. A person can receive chemotherapy, different treatments prior to surgery, after surgery. It can be a big combination. Okay. Otherwise, a person may very well go for their colonoscopy. It could be their first one, a follow-up one. It could be something that was prompted because they had some symptoms that didn't seem right. And then, unfortunately, that leads to a positive diagnosis of cancer. And then we bring them in and begin that treatment process. And hopefully with patients, we catch it soon enough that we can. Colon cancer is truly one of the most detectable, survivable, treatable cancers that there is. But the importance is finding it at an early stage.
So, that kind of led me into the next question was, once it's found, what are the outcomes generally for this type of cancer?
So that can be a multifaceted answer as well. Best case scenario is that it's caught early, a stage 1 cancer, and many times that can be surgically treated. Many times it can even be treated with a biopsy, removing the malignancy, and maybe not even having to have any what we call adjuvant treatment afterwards. Most of the time, that's not the case. It's usually at least at a stage where we need to do some treatment. Again, surgery is many times a part of that.
So between you, the both of you, Abby and Rene, do you guys work at any point together in a person's journey? So if either of you have maybe an example of someone who had kind of a positive, they took your advice, they got the resources, because that is, no one wants to hear a cancer diagnosis. Right. So kind of what you were telling me at the beginning was, you guys are there for them. You guys, right at the very beginning, you have resources. You're a support system for them.
That's right.
We work very closely
literally
together.
Next door to each other.
Yeah, literally next door to each other. But again, the navigation, they are on top of what a patient needs. And so if Rene sees any indication in that first assessment with her patient that they have a nutrition need, whether it be a nutrition-related side effect that has been going on since some of these symptoms had started, or post-treatment starting, they're starting to have some effects from the chemotherapy or the radiation therapy, then we're right on top of it, trying to make sure that the patient is being taken care of and, supplying the need right where the patient is at.
Right, yeah. And it's, I guess what you're saying is it's a kind of a moving target. You guys are along for the ride. You're based on the person's symptoms, issues, outcomes, process phase of it that you guys
it's ever changing.
Yeah, and you guys are tailoring it to that specific patient.
Absolutely.
And it's not just a one size fits all.
That's exactly right. Just yesterday I was checking on a patient after her second treatment, and she was having some nutritional challenges. And so when you get into these conversations with patients, and as a navigator, we do have the time to do that. That, a medical office is a fast-moving pace.
Yeah, you're in there.
That's
you wait for a long time, but you're in there for maybe 15 minutes.
That's right.
With the doctor.
I have to say our providers take the time that they need with our patients. But, there's a reality that there's a time limit there. And so they reach out to us and let us know when they identify a patient need that they know a support team person needs to be on. Right. But as I checked with this patient yesterday, I began to kind of peel back the layers of her nutritional needs, because I said I would suggest something and she said, well, my mom doesn't like that. She doesn't like this. So I would make suggestions, and I pretty much had ended my suggestion list. And so therefore I made a recommendation to Abby, and she'll follow up with that patient and, monitor their weight loss and that kind of thing. So it's very much a moving target, and it's very much a collaboration between us.
Right. And I know, I feel like a lot of people would say, I have to change my diet. Like it would be a negative thing for them. But something I've heard just kind of in my own research is you're getting a chance to try out new foods that you maybe otherwise wouldn't have even considered.
Absolutely.
That it could be a positive thing.
And that's something that I will recommend to patients when you're undergoing the different treatment plans that we offer for our GI related cancers. There are some taste aversions. There are some, nausea and vomiting that affect what you desire to eat, different types of things. So when I present the opportunity to maybe try something else on the menu that you wouldn't typically get versus what you always go for, I do have a lot of patients surprised at, wow, that did work for me at this moment in time.
Yeah, just making it say, this isn't a negative thing. I can't not have certain things. Like now I can expand my diet to more things that maybe I was already used to.
Yeah.
Great. So let's get into the screening. So Elizabeth, do you want to kind of give us an idea of how the screening goes? What are the dates and times for that?
Yeah, of course. So we're excited this year to be able to offer a colorectal cancer screening in partnership with Cologuard. This is the first time that we've done anything like this with Cologuard. And so we are having 2 different days with some different appointment times that are available for the community. So our first screening date is going to be Thursday, March the 20th. It's from 4 p.m. to 7 p.m. at Kirkland Cancer Center. And our second screening is on Saturday, March the 22nd from 8 a.m. to 12 p.m. at Kirkland Cancer Center as well. And so this screening is a little bit different than what we've done in the past with our other screenings. You will call and make an appointment. And so the number to call is 731-541-1742. And once you get that appointment, you will have a one-on-one education session. So you'll be given a date and time for that. And during this education session, we will really just educate everyone on what Cologuard is, how to use it, how to send it back, and then how you'll get your results. So once patients are done with their education sessions, they'll leave the cancer center. We'll order the Cologuard kits, and they'll be shipped directly to their homes.
Oh, okay.
They'll use the instruction that we gave them during their education. They'll send those back, and then they'll have their results within 2 weeks.
Okay, great. So this is like really helpful for this community and making sure that you're catching it and you're catching it early.
Yeah, absolutely. And, one thing to note is that we are 100% not saying that you should not have a colonoscopy, because we do suggest colonoscopies. However, this is another option for patients who may not get a colonoscopy for whatever reason it is, but they would have this or do this as another screening option, because it is so important that people get screened. And so, whether it be colonoscopy or Cologuard, we just want you to get screened. So if you are 45 and older, no matter what that method is, what that looks like, we want you to take care of yourself and prioritize this. So if it is Cologuard, then we suggest that you just call us at that number and we get you scheduled.
Great. And are you guys going to be there for the screening or for the education, I guess, portion?
Yes, we absolutely will. We'll meet with those patients one-on-one. We're allotting about 20 minutes per patient, and they will not go home with the kit, but that will be the moment when we order their kit.
Right, okay.
And then it will arrive at their home within,
3 to 5 business days.
Okay.
And it's a very simple process. And I can say from my experience as a navigator that, I have a statistic, but certainly on a routine basis, I do see new colon cancer patients that are at our cancer center from a positive Cologuard diagnosis.
Okay.
Now, a positive Cologuard diagnosis is quite accurate. There's about a 95% accuracy with this test, and it detects other things other than colon cancer. It's a DNA test, so it's very different from other at-home tests. But that will prompt a colonoscopy. So a Cologuard is a once and done only if it is a negative until next time.
Okay, right.
Because the importance about colon cancer screening is to stay up on the surveillance. You don't just get one and then you're done forever. So different criteria for different ages, for different risk factors for that. But we're going to walk the folks through that so that they'll know what they need for the future.
Right. And in terms of a colonoscopy, I have some family members who have recently had some done. It's not the same as it used to be. I've heard that it's not quite as awful of a process leading up to it, maybe.
It's not,
If people are maybe, not wanting to get one because they're thinking, oh, I don't want to have to go through all that.
That's right. You could do an entire podcast on just the colonoscopy because everybody has an opinion about it.
You know what? We should do it visually and then have the diagrams and everything.
That's right. But breaking it down, definitely, there are different prep options out there now.
Based on, I guess, what
there are, and it really is a physician preference. But what I would encourage people to do that are looking at their colonoscopy, get online and research the different options and then speak to your provider about that so that you can do the prep that's going to, suit you the best, that's going to give you a successful prep so that you can get the best colonoscopy and be done.
Yeah. And again, like you guys have been saying, having that information, having that education, knowing about it yourself, you guys are advocating for that person, and that person can advocate for themselves as well.
That's
within this whole process.
That's right.
Yeah.
And we'll say too, for as much as the thought process comes along and talking about the uncomfortableness of
Yeah.
it, in the reality, 24 hours of some uncomfortableness leading to a life-saving measure, I mean, speaks volumes itself.
Right. It's you have to do something a little less comfortable, and especially, even with the dietary needs, you're saying you're sacrificing, but it's in the long run, you're doing yourself a favor.
Absolutely.
That's right. And so that we don't lead people in the wrong direction. It's, typically the day before, 18 to 24 hours, you don't eat anything, but you can have clear liquids and broth and things like that. Right. And then the prep usually begins in the evening before. Most people can even work the day before their colonoscopy.
And then you've got it done until the next time.
That's right. You get it done, and then you don't know it. You feel no pain. So it's really a very survivable test.
Right.
Yes. And Kara, something else to just add is a lot of people don't realize that, several years ago, the age was 50 for colonoscopies, and that has recently changed. And so it's 45 for colorectal cancer screening. So I think our biggest urge for anybody listening today would be, if you are 45 years or older and it is time for your screening, then you need to get that scheduled.
I'm really glad Elizabeth said that, because it was actually in 2017, the guideline changed from age 50 to age 45, and that's endorsed by the American Cancer Society, American College of Surgeons, and the Society of Gastroenterologists. So it's widely endorsed in our nation. And from a hands-on perspective, I will say, because a lot of people think, well, colon cancer, that's something that happens to you when you're older. That is simply not true. My youngest patient has been 29, and my eldest patient has been 91. Oh, wow. So, certainly there's a age range where it is more common, but colon cancer, along with many other cancers, is non-discriminatory. It can just happen. There are risk factors, and we need to pay attention to those. But colon cancer, again, it's just all about preventing and screening.
Right. Yeah. And with these screenings, you want to catch it as soon as possible. That's something I've heard in a lot of these podcasts. Is early detection is the best.
That's right.
So for the screening, I will have all of this information on the podcast show notes. And we also, if you want to follow Kirkland Cancer Center on Facebook and also the West Tennessee Healthcare Facebook, I will share their information. They've got a graphic out with all of this information. The number to call if you want to schedule is 731-541-1742. And again, all that will be on our socials and on the podcast show notes. Do you guys have anything else to share before we wrap up?
I don't think
Just can't encourage our community enough to check into this. We want to do as much as we can to help people get screened and guide them in the right direction. Because again, colon cancer is so very treatable.
Right.
So catch it early.
Yeah,
and
that's good to hear.
Help.
Yeah,
That's
especially
right.
with that, and especially with Kirkland Cancer Center, all the work that you guys do. It's very encouraging to have that here in the West Tennessee community.
Thank you for having us.
Great. Thank you guys so much for coming.
Thank you.
Thank you.
Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.